Well, heads up for people in Portland if you want to get your flu and COVID-19 vaccines. There's some clinics opening up across the city this month.
Here to tell us more is the city's interim public health director, Bridget Rauscher. Thank you so much for being here this morning. We appreciate it.
Thank you so much for having me.
Yeah, so let's just talk about where are these clinics, when are they happening, all the ins and outs of that.
Sure. So our first public flu clinic will be this Friday, October 4th, from 9 a.m. to noon at 39 Forest Avenue. It's our public health clinic. Then we have a series of additional open to the public clinics, primarily for people who are un or underinsured, but also for people who are insured. And if you're insured, we ask that you bring your insurance card. And it's really great opportunity. We're trying to offer clinics as far and wide as we can right now.
Who is eligible to get the shots? And here's the other question, are some of them free or not?
Yeah, so certainly for people who are un or underinsured, they will be, they'll have access at no cost. And anyone ages 6 months or older is encouraged to get both the flu and COVID vaccine. As well as, pregnant women, women who are breastfeeding, anyone over the age of 65 or who might be at an increased risk of serious illness.
Why is this so important to offer to the community? I mean, are we seeing an uptick? I know in general we are, but what are we seeing in the city of Portland right now?
Yeah, so our statistics come in a little bit behind schedule, so it's a little early to tell what's kind of currently happening right now. But it's kind of like at the beginning of COVID where, you really are helping to protect your community. So it's not just for you, it's for, other people who maybe are at an increased risk. So it's really a community effort.
Yeah, and speaking of community effort, this is the time to do. You're talking about folks coming out of August, they're on vacation, probably brought something back with them, and kids are starting school, whether it's elementary school, middle school, high school, or college, and so that's when I think you get the uptick, right?
Yeah, absolutely. The beginning of flu season is kind of now, and it can go through, February or March, so it's a great time to get it that will last through the flu season and kind of active COVID season.
Yeah, and what can people expect when they walk into one of these clinics?
Sure, so, based on demand, they may be a little bit busy, so people are, you can walk in, they're not by appointment, sign in. You may have to wait for a few minutes to have somebody who's available to provide the vaccination. Just fill out a form. There will be lots of people there who can help if folks need assistance completing the form or if there are any language barriers. And then you'll receive the vaccine, be observed for about 15 minutes, and then on your way.
Besides vaccinations, what else can people do? What do you tell city employees and even the general public?
Sure, stay home when you're sick. I would say that's the biggest one. If you have any symptoms, being mindful of staying home, keeping kids home from school who are sick, wearing a mask if you are experiencing symptoms and you do still need to be kind of out and about in the world.
Is it just, COVID and the flu that we're concerned about right now, or are there any other, illnesses that you want to get the word out about?
Sure. So, of course, you're always concerned at this time of the year about RSV and, whooping cough and things like that for children. So those are things to be mindful of. They're definitely, here and will be here throughout the season.
How about COVID-19 tests? A lot of people get a little bit of a cold. Some people will go to work, go to school if they have a little bit of sniffle or whatever like that. But if they think they might have COVID, where can they pick up tests through the city? Or?
You can, I don't know that we have them available on site, but you can certainly get them at any pharmacy, CVS, Walgreens, et cetera. And there are no-cost tests. If somebody would like to give me a call, I'd be happy to connect them with a no-cost test.
Are you getting inquiries from people, asking about this? And have you done, these clinics in the past?
Yeah, we have always historically, as a public health provider, offered community flu clinics. It's kind of a pivotal piece of public health. And they're definitely more popular and kind of more well-known since the onset of COVID. So we are certainly, out there and making sure people have access.
How important it is because we're just got done with COVID, right? And it's kind of in the rearview mirror to keep, thinking about this, that, we want to keep another pandemic, you don't want everybody calling. I know my kids, in school, they're talking about so many people that are calling out sick right now. So we keep people vaccinated, keep people from going to school when they're sick or going to work. So we don't get so many people, sick and having to leave work or school.
Yeah, I mean, that's the key, right? So doing your part will really help the greater community. And I think that kids who are back to school and feeling unwell, keep them home. We have a 3-year-old who's at home sick right now, and it's like no school. That's the best that we can do, and it certainly is a change. But we're all of us being really aware of each other, taking care of each other.
And where can people learn more about the clinics? I know you said when they are, but just to find out more. And do they need to make an appointment? They can just walk in?
No appointment,
Okay.
all entirely
Great.
walk-in for the open clinics. They can go to portlandmaine.gov and see the clinics, also our Facebook and Instagram pages, and they could also call me if I can offer my phone number.
Is this something that's going to take, like, can do during a lunch hour, or do right after work, or right before work, or is it something that's going to take an hour and a half?
No, it shouldn't take that long. We usually are well prepared to meet the community demand, and again, 9 to noon. If you get in early, it's usually you can get in and out pretty quickly.
All right. Well, thank you so much. We appreciate it. Trying to keep everybody healthy.
Yes,
Great.
thank you.